Sexual education in schools has been a subject of intense debate for several decades. Supporters argue that providing comprehensive sexual education is essential for promoting healthy relationships, reducing the prevalence of sexually transmitted infections, STIs, and preventing unintended pregnancies. On the other side, opponents believe that such education should be the responsibility of parents or religious institutions, and that schools should focus solely on academics. This debate raises important questions about the role of schools in shaping the sexual health and behavior of young individuals. Proponents argue that sexual education in schools plays a crucial role in promoting healthy relationships. By providing students with comprehensive knowledge about consent, communication, and respect, they argue that young individuals will be better equipped to navigate romantic relationships in a responsible and respectful manner. Additionally, comprehensive sexual education can help dispel myths and misconceptions surrounding sex, fostering a greater understanding of sexual orientation, gender identity, and diversity. Opponents of sexual education in schools often express concerns about the age appropriateness and moral implications of the curriculum. Some argue that discussing topics related to sex may encourage promiscuity or lead to premature sexual activity among students. They believe that such discussions should be left to parents or religious institutions who can incorporate their individual values and beliefs into the education they're provided. Additionally, opponents emphasize that schools should prioritize academic subjects and leave personal matters to be dealt with outside the classroom. One of the key arguments in support of sexual education in schools is the potential to reduce the prevalence of sexually transmitted infections, STIs, and unintended deaths and pregnancies. Proponents argue that by providing accurate information about contraception, safer sex practices, and the importance of regular checkups and screenings, schools empower students to make informed decisions regarding their sexual health. Comprehensive sexual education can equip adolescents with the necessary knowledge and resources to protect themselves and their partners. Opponents often express concerns about the potential promotion of values and behaviors that contradict their cultural or religious beliefs. They argue that sexual education in schools may challenge traditional family structures and moral values, leading to a deviation from their desired cultural norms. These individuals believe that the responsibility of teaching about sexuality and relationships should lie solely with parents or religious institutions, allowing more personalized and value-based approach to instruction. It is important to consider the potential consequences of excluding sexual education from schools. Without proper guidance and access to accurate information, young individuals may turn to unreliable sources or rely solely on peer-to-peer advice, which can perpetuate misinformation and unsafe practices. By integrating comprehensive sexual education into the curriculum, schools can ensure that all students receive consistent and evidence-based information, promote responsible decision-making, and overall sexual health. In conclusion, the topic of sexual education in schools remains a contentious issue with passionate arguments on both sides. Supporters highlight the benefits of providing comprehensive knowledge, promoting healthy relationships, and reducing the prevalence of STIs and unintended pregnancies. Opponents express concerns about curriculum content, age appropriateness, and the potential deviation from cultural or religious values. Ultimately, finding a middle ground that respects the diverse needs and values of communities, while prioritizing the health and well-being of young individuals, crucial.